let them know that you're going to hold this community event. And who is it for? It's for it's for carers that look after loved one. It's for service users. It's for friends and family of a service user, for example. And you also let social services know, or you let social services know, you let the integrated care boards know, you let the GPs know what you're doing, you let the daycare centres, day centres know what you're doing, for example, community centres know what you're doing, for example, and you go around and visit every single week, and the date is a month later, and you will have, if you do it correctly, you should have a room full of people, not with a view for you to do a transaction. You're not there to do a transaction, you're there to talk about what it is you have to offer, but also at the same time you want to hear from them. You want to know what need is needed in the community, what is lacking, how can you help them. You want to be of service to them, to all of them, as well as the healthcare professionals, like the GPs, like the social services, for example, like the community centre, like the day centres, for example, and the care homes. Meet your community. Stop just thinking you can just pick the phone up or post something on social media and you're going to get loads of work from that. It's like everybody is in the same fishbowl and no one's jumping out of that fishbowl and becoming unique. You want to be unique, you want to stand out, this is the way to do it. 2025 is a year for community. It's a year for peace. It's not a year for for discrimination. It's not a year for separation. It's a year for us, you, the care provider, to communicate with your community and to serve your community. And that is how you can control things as much as possible for your business, for example. And I know things are difficult right now. I'm seeing what's in the news, but I'm not focusing on what is in the news. I want to focus on you to be able to provide a good service. And I also want you to look at going out and meeting organizations that you want to work with, that you want to collaborate with, that can give you work. And that is the community, and that is the government organizations. You'll be doing something different from what everyone else is doing. Who do you think the social workers, the government organizations will want to speak to? Do you think they'll respond to you on social media, or do you think they'll respond on a telephone call or an email? Do you think they would respond more if you gave them the invitation? I'm referring to government organizations here. You gave them the invitation to come and join you at your community event. Don't you feel that they'll feel pulled? There'll be kind of like an obligation, because they want to also make sure that their clients, the service users, are getting the best of the best. And we need to give this a go, because there's too much separation here. We're not competing against one another, but you are a care provider. If you're a care provider, even if you're a business, you should be doing these things anyway. You should be meeting your community. I've been a will writer. I used to do wills and trusts. I even used to have events for that as well. The community needs to hear from you what it is that you've got to offer. But you don't go in all guns blazing, for example, thinking that you're going to get a transaction. If you're thinking that way, then don't bother, because it's not going to work for you. You got to go with a serve mentality, that you're there to serve them. You want to hear and help them and educate them to really have a great communication with one another, because they can get to meet one another as well in your community event. This is a game changer. If you can do this and you get your banners, obviously you're going to take your company promotional banner and things like that, and you do a presentation. You stand and you talk, you meet people, find out what the needs are. Even use the whiteboard to write what they've said to you, for example. You've got to think outside of the box now. We cannot be doing this online constantly, over and over and over. It's looking tiring. It's looking old. Think differently. Try different things. Don't keep doing the same thing over and over and over again. Try different things, and this is the new way. It was the old way to begin with, and it's come back. This is the new way. 2025, you've got to focus on community building. Whether you do your event once a month, but you're also talking about your event on YouTube on a regular basis, that this is what you're going to be doing on this day. You want to hear from the community, and you target the area where you are. And there's a way that you can do that, to target just that location by putting in hashtag and then your town, for example. I've got lots of, things that I can talk to you about, and I want to share this with you, because it's also breaking my heart that the community, they're not getting this anymore. Everyone's jumping online. Some people are lonely. They need this communication. They need to know that someone's listening to them and someone's hearing what their needs are, and that you're able to help them. It could even be filling out a application form. They could be struggling with some paperwork. What is it that you can help them with? And I'm saying, don't go there on the basis that you're going to charge them. You're going to do it and serve them. Serve your community. Be of service to your community and help them, because they need you. You set up your business for this purpose, to help. I believe that's why you've done this, to help the community, right? So why not do that at least once a month? One day out of that month, you go and serve your community for free. You don't charge anything. You complete application forms for them. You help them. And guess what will happen? when they need care, who do you think they're going to go to? Someone on someone's website or social media, or will they come to you? Who do you think? I'd love to hear your comments in the chat. Who do you think that they will go to? Who do you think service users will go to? Who do you think social workers will turn to? Who do you think GP surgeries will turn to? They will turn to you because they know you and they've met you. They've met you in the flesh. They've heard you. They've listened to what you've had to say. They know that you've got good information. You're educating the community about care. Become the expert at showing them what is involved in you providing care. You could even bring one of your team members who do really well. For example, one of your carers that is extremely talented, and that carer can talk about what it's like working for your organization, for example, and what they do. You could even do that for when you are looking to recruit. You could have a recruitment day every 3 months, but have a community day once a month. And in that day, you're going to talk, communicate, you're going to sit down, everyone's going to have their tea and coffee, and you're just going to talk about care. And then at some point you possibly do a bit of training where you're talking about what is involved in care, what level of care do you provide, for example, what your experience is, what you know about the community that you live in or that you serve, because you've listened to those that live in the community. And you know what? That's going to help you for when you apply for contracts, that you've gone into your community to talk to them, to find out what the needs are. And you will then discuss that in your contract that you hold. You know, it's like a community initiative. That's what you're doing. And it's